this session, and Mr. Nobin Roy, Assistant Professor of CSE Department, is the chairperson for this session. The speaker for this session, Dr. Pranav Hazasar, is the head of the Department of Electronics and Communication Engineering at Narula Institute of Technology, Kolkata. Dr. Hazra has over 17 years of teaching experience and research experience also. He earned his PhD degree from NIT Durgapur in the field of biomedical signal processing. He has several research areas such as medical signal processing, machine learning, deep learning, 18 years of and healthcare analytics. He has published numerous research papers in reputed international journals and conferences. He has also authored of many books and chapters and holds several patents also. He has the member of ISTE, EI and IEEE. His research excellence has also been recognized with the Best Paper Award at the international conference. We are truly honored to have such an accomplished academician and researchers with us today. Without taking much more of your valuable time, I warmly welcome Dr. Ponu Hazra and invite him to deliver his valuable talk with us. Sir, this session all of yours. Please, sir.
Thank, thank you, madam, for your nice introduction. Let
Thank you.
me let me share my screen.
Sir, you can start your session.
Yes, I'm trying to share my screen.
Okay, sir.
Problem is occurring here. I am logging out. Again, login.
Okay, 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 sir. Teaching experience. Dear participants, please wait for few more time. Our speaker will be joined shortly. Yes, sir.
I think it is fine.
Yes, sir. Yes, sir. Absolutely.
Okay. So thank you again, madam, for your nice introduction. So sorry for some technical glitch.
Okay, no problem, sir. No problem. It is our honor that you are with us.
So today, I will discuss something about the neurodegenerative diseases, and then we go for the some systems, intelligent healthcare systems, how it can be monitored. Because monitoring is necessary, diseases will be there, and it is there from very early days also. But it's monitoring is necessary nowadays. What is there in the current field, that trying to solve something after getting affected by the disease by the person. But if we start monitoring regarding this any kind of disease, I am concentrating on the neurodegenerative disease. So it will be better for the health, and which will serve the society better also. So I'm going for the next. So first, we have to know what is neurodegenerative disease. Thing is that neurodegenerative disease, basically when disease affected, before that certain neurons stop working, and that disease stop working occurs due to some other electrochemicals, or we may say some other proteins. Because of, I'm coming to that part detail in the latter part, and that causes some disorders in the nerve cells. Okay, nerve cells. So thing is that, so because of that proteins which will disturb the neurons, so neurons are very sensitive. So because of that protein, they will stop work. And if that neurons are stop working, what will happen? They will getting damaged, and once upon a time it will be done. Like suppose some cricketers, some footballers, and those are the sports persons. They will do practice every day, almost every day, few hours. Why they do? Because if they do not do practice, performance will degrade. And suppose for a 1 week, for a 10 or 15 days, they will not do practice, the performance will degrade. And if it will continue, once upon a time, it will be deteriorated and it will be very bad. So like that, when the neurons stop communication between them, between the cells, okay, they think that they will no work, so they will start to stop to perform working, and once upon a time, the cells will die. Because in this way, the persons will getting affected by the disease. So this is basically neurodegenerative disease. If I say what is that, because of some external influence, neurons stop working, and as that influence getting increased, so it will progress. That is, progressive neural damages will start, and once upon a time, certain cognitive decline will appear, and that will effectively result into the dementia. So this is the basic things of neurodegenerative disease. That means when neurons will stop work. So I am coming to some common neurodegenerative disease. These are Alzheimer's disease, Parkinson's disease, Huntington's disease, and amyotrophic lateral sclerosis. So all four are very important disease because in view of the World Health. And if I go with personal life, first two diseases are very serious. Alzheimer disease, this is because of memory loss, confusions, these are the things. But the main culprit behind these are that proteins or the damage of the neurons. The symptoms with the Parkinson disease are the tremor, stiffness in the muscles also. So balance problem. These are also the symptoms of that Parkinson disease. These two are very serious disease, which is generated basically from the brain cells because of the deafness of the brain cells. It is generated. Huntington's disease. This is also the brain disease which affect the uncontrollable movements, mood changes, difficulty in coordination with others, and sclerosis, ALS, which is basically the symptoms with the muscle weakness. Among these four, all four are very serious disease, but among these four, first two are most important to take care. And if we go with only the brain-related disease, which is mostly affect the society also, as well as the family persons, that is Alzheimer. So, I will not go with the all disease. I am just discuss here today regarding the one neurodegenerative disease, which is Alzheimer disease. Parkinson disease, Huntington's disease, and sclerosis we will not discuss today here. If there is any scope, we will discuss later. So I have said that these all are due to the neuron. How it is affected? We know this is basically neurons are our transmitter. Like in communication field, it is like a transceiver system. It is also having one neuron will act as a transmitter, another neuron will act as a receiver. Suppose here in this figure, it is having working as a transmitter and the next one working as a receiver. And that junction to which the information or signal is transmitted is known as synapse. This gap portion where is some connectivity is there with two neurons. And that within that gap, certain potential is generated. Potential barrier is there, which is known as the action potential. Basically, our neurons or our body can be considered or can be viewed as a circuit also. So here also it is acts as a circuit where this gap having a action potential. So action potential means something barrier is there. So that barrier has to be crossed by the previous neurons information. That only after that the information can be transmitted to the next neuron. So what is the signal here? Signal is the electrochemical signal. Basically, if we go with the communication system, so suppose I am talking with one person who is located at Mumbai, so we'll talk over phone. So my speech signal or voice signal is acts as an information signal. So here the electrochemicals of body or the brain is acts as a information signal, which will be transmitted from the previous neuron to the next neuron. But the thing is that information has to be that amount of energy so that this barrier which is exist at the synapse, in that gap, can cross. That means that amount of energy is needed. But the thing is that if certain protein, extra protein is deposited in that gap, so it will increase the potential barrier more. So for a electrochemical signal, it is quite difficult to cross that barrier and go to the next neuron. If we draw analogy with our communication system, what I am talking about, suppose I am talking one person who is located in Mumbai. So I am talking over the phone. My voice signal goes to him or her, but that is not go in the direct way. So that is go through some modulation process. And modulation means as because of our voice signal energy or the energy is very, or we can say the frequency is very less, that cannot have the capability to reach directly to the Mumbai. So we have to take the technique of modulation. Modulation, that is some energetic signal which is known as a carrier signal, which will carry that low energy signal. So here, so there is no that kind of in the brain, there is no that kind of carrier signal is exist, and externally it is quite impossible to impose within the brain the extra signal of high energy, that is high frequency signal, which will be the dangerous for the brain also, the body also. So it is quite impossible. So which signal exists within the brain, that only has to be transmitted. So that signal which I am telling about, the electrochemical signal, which is known as the neurotransmitter also, so that have not so much energy so that it can cross the extra barrier. Only which having the action potential, normal barrier, that can be crossed by that signal, that is the electrochemical signal. But due to the deposition of the protein, if the extra barrier will be created, so that will not be communicated. So what will happen? So next neuron will not get any information from the previous. So what will be done by the next neuron? So for a long day, if that neuron will not get any information from the previous neuron, so it will start to stop working. And after a long day, it will damage and effectively it will die. So because of that, the problem is generated within the brain. Now, I'm telling about, today I will discuss only on the Alzheimer's disease, which is the important neurodegenerative disease. So here the problem is with the difficulty in remembering, thinking, or taking some decision. It is very disturbing to a person to do some daily activity or recall something in the recent past event, which will be irritating for any person also. So we have three kinds of dementia. One is Alzheimer's disease, another is mild cognitive impairment. I'm coming to Alzheimer's disease and mild cognitive impairment. And there is another one, vascular dementia, which is again occurred due to the deposition of the protein. Basically, deposition of the protein means when it will done, when the sufficient amount of oxygen flow in the brain will reduce. That will be the main cause. And another is dementia with Lewy bodies, which is caused due to the uncontrollable blood pressure and uncontrollable temperature, like that. So because of that, this type of dementia may causes. But the thing is that vascular dementia and dementia with Lewy bodies is not so much dangerous. If it is quite normal. It may happen with maximum number of people, but which will not affect or which will not result as a dementia, the Alzheimer's disease or dementia also. But mild cognitive impairment will convert it into the Alzheimer's disease later part, and when it will be affected, it is known as the Alzheimer's disease. The thing is that why we do detection of Alzheimer's disease, or we can say what we will go for studying with the neurodegenerative disease. So among all these kinds of neurodegenerative disease, Alzheimer's disease, hello? Hello? Any problem?
No issue, sir. You continue, sir.
this Alzheimer's disease is basically ranked as the seventh. Ranked as the seventh for the cause of death worldwide. But other neurodegenerative disease is not ranked before that, and it is not also ranked within 20 also. And another thing, some studies has also been revealed that by 2050, the affected number of people by this disease will be 135, almost 135 million, which is very alarming for the worldwide, for the healthcare system. And it can only be controlled if the disease can be considered or disease can be detected in the early stage. And it can possible through some tests and through some memory test also. That's why its detection is necessary. And another thing I can say, it will affect the family and society also largely, because if we consider one example, suppose one pupil is interacting with another one, and who is having the Alzheimer's disease, he cannot recall. Suppose discussing is going on with another type of disease, and one person who is affected with the Alzheimer's disease is communicating that with some doctor's name under whom he gone through the treatment, and he is suggesting someone the name of the doctor, but he cannot be able to recall the doctor's name. So what is the situation? The person to whom he is suggesting, he or she is suggesting, is not getting the relevant information, and who is trying to recalling the name, he is not be able to, and he or she is getting irritated. This is a small scale. Another thing, when it will go for the severe stage, so it needs to take care of that person. So caregiver is necessary from the family, and when it considered into the large scale, the society. So for the society also, that kind of people needs to taken care. So what will happen? The effect is that people and society will not get the important information. Instead of that, they will have to be engaged for their take care. It will be disturbing situation. And if in a family, this kind of patients are there, so for a long time, taking care of him or her will be quite difficult. So it's better to go for the monitoring at the early stage. So what I am telling in the first slide, the causes. Causes is two proteins, beta amyloid plaque and neurofibrinogen tangles. Both are proteins. So here in the picture you can see these are the plaques, amyloid proteins. And interestingly, that I'm coming to that later. That amyloid proteins will deposited on the neuron. Here you can see on the neuron it is deposited gradually. The interesting thing is that deposition will be influenced by another protein, which is named as APOE protein, apolipoprotein, apolipoE protein. That protein is the influencer. APOE will influence, deposit the amyloid beta protein onto the neuron. Now, initially, when it is start to deposited, no problem. It will just affected. It will just affected like that person will forget something, forget some recent events that can be tolerated. But when it will be go to the severe stage, it cannot be tolerated, or it cannot be bearable also. Now, another thing, the neurofibrinogen tangles. What is that? So here the green color it is showing the neurofibrillary proteins of the tau protein. This is also protein. That neurofibrillary tangles formation will be done by the tau protein. And this green color shows the normal tau protein. That blue color shows the abnormal, that is misfold tau protein. When this misfold tau protein will be generated, and that will be generated within the twisted fiber within the neuron. Within the neuron, there are some twisted fibers. The red color or the brownish color here, it's showing the twisted fiber. So when this blue color misfold tau protein will be generated in the twisted fiber. So what will happen? The tangles will be generated. So because of that tangle generation, that twisted fiber will stop working. As it grows, it will stop working. So because of that also, the communication will be stopped from one neuron to other neuron. And already I have said that amyloid beta protein is the main responsible protein to stop communication from one neuron to other neuron. Because of that, and as it progresses, so the brain volume starts to shrink. Why it starts to shrink? Because when the neurons start to stop working, so it will gradually one by one neuron will die. As one by one neuron will die, so overall the volume of the brain internally will start to shrink. So this is the main cause of two things, beta amyloid protein and the neurofibrillary tangles. These two proteins, neurofibrillary tangles are not protein. This is generated due to the tau protein. This tau protein, it will be generated. Basically, the responsible proteins are beta amyloid and the tau proteins are the responsible protein generally. But there are huge number of proteins are there, almost 2000 proteins are there. Out of almost 10 to 20 proteins are responsible. From the research, it is revealed that 10 to 20 proteins are responsible, but most responsible are these two. But nowadays, research is going on that other some proteins are also parallelly responsible for this type of diseases. So another cause we call as that those who have the hypertension and diabetes, these are also the reason of doing the Alzheimer's disease. Symptoms generally divided in three stages. What I have already mentioned, that is early stage. That means forgot about some recent events and inability to recall the recent events also. This is known as the episodic memory loss. Basically, episodic memory loss is not so severe, which can be managed. But when we enter into the progressive stage, what will be the symptom? Difficulty in decision making and difficulty in expressing the thoughts or the plans he or she have done. So this is severe stage. And what happened in this stage? Confusion regarding the time, place. That means he or she cannot recall which place he or she was there half an hour before or one day before, like that. So it will be the dangerous one. And some behavioral changes will also be done. Mood swing will be there for the common people, those who have affected in the progressive stage of the Alzheimer's disease. Or progressive stage is basically known as the MCI, mild cognitive impairment, which is later stage getting converted into the disease Alzheimer's disease. Late stage means the Alzheimer's disease. That means the person affected by the disease. So there the problem with the previous problem, that is recalling of the event, difficulty in the expressing thoughts. With that, another most important problem will be introduced, that is motor difficulties, that is movement problem will be generated with that patient also. With that, there will be aggression will increase. Aggression will increase within the within the patient. So, which will be very disturbing for any family, for any people, those who are surroundings with him or her. So basically, there are the three symptoms: early stage, progressive stage, and the late stage. Treatment, there is no treatment is there, but no cure is there of this disease till date. Only symptoms or only the progression can be managed or progression can be slowed down. This is the treatment only, and that can be done by some medication, physical therapy, and supportive care also. Supportive care means who is the caregiver or the concerned family person or the relatives. They will talk such a way that he will not get into the aggression, or he will get some relaxations also like that. But it is not possible by all the time for by all the relatives, all the family persons. So who is closely taking care of him or her? So he can also be can only do these things. So and another thing, special expertise also sometimes needed. But whatever it may be, that can be controlled and that can be slowed down. The progression can be slowed down. But if the detection will not be done and care will not be taken, so it will progress very rapidly. So that's why the data shows that by 2050, it will be 135, but it may cross also. In some studies, it is also having shown that 150 million. So which is not at all less number of patients or less number of people who will be getting affected. So that's why concentration is given on that disease. That's why I'm discussing today. Compared to Parkinson disease also, it is not ranked as a seventh cause of death, and it is not having so much people will be affected. Till date, affected people is there, but which is almost, if you compare with the Alzheimer's disease, it is the percentage, in percentage, almost 40% less than the Alzheimer's disease. Basically, as per the clinicians, said that the Alzheimer's disease occur in the older age, that is 60 and 60 above, or the 65. But no, its symptoms or its the disease introduces within the people in the early stage, in the 40, like the age of 40 or 45, it is started. But as it is, no symptoms will appear, so it cannot be detected or it can be recognized. But for some people, it is not for some people. Those who are getting affected in the age of 60 and 65, they are start to introduce this disease at the age of 40 or 45. This is actually known as the young onset of the disease. So why we are talking about the early detection of this disease? Because if we start to detect at the age of 45 or age of 50, so it is quite easy to go through some therapy, go through some monitoring, go through some treatment, so that we can slow down the progress. And ultimately, in some cases, it has been observed that through some therapy and through some technique, that ultimate affection of the disease can be restricted. So that's why it's important. And age is not only the 60 or 65, it is actually started before that, which will be 45 or 40. So if the family people can monitor this, so it can be, family people means the system can be, system has to be generated. Till date, that type of system is not there, but people are trying to generate or create this type of system so that family people can also monitor. Till date, what is there, that is you have to go for hospital, or you go for some clinic, or go to some expert, so that after several sittings, it can be detected. Non-invasive. They are invasively, it can be detected easily, but that invasive process is not so much comfortable, and in some cases it is not so much less expensive. It is very expensive also. So its monitoring through some other processes needed. And coming to that, so what I'm telling before, So this is the brain anatomy for the normal brain and the Alzheimer's disease. And the left side, what is showing, it is the normal brain. You can see the cortex. Cortex means what we have the skull, below the skull, this cortex is there. It is the largest part of the brain. So it is thick also. Here you can see, and there is a white matter which is healthy. But when we coming to the right hand side, it is a disease brain, the Alzheimer's disease brain. We can see the cortex part is becoming thinner, and white matter, ventricles. So here you can see that in right hand side, ventricle size is in the normal, that is very less, very small. But when it is disease affected, ventricle is enlarged, and you can see also another portion, hippocampus, that is also getting shrink. So hippocampus is very important here for that. First, I am coming to that overall brain size. From the picture is also it is clear. Overall brain size is decreasing. So volume, brain volume. So what is the reason? The reason is that due to the death of the neurons in the brain. Because of that, the brain size start to shrink. And ventricle size, obviously, if the neurons will be diseased, so it will get in space, so ventricle size will be enlarged. So these are the parameters from where we can detect the disease from the early stage if we monitor. And as we all know that our brain is divided in 4 parts: frontal, occipital, temporal, and the partial lobe. So the temporal and occipital is the main responsible region of the brain to detect the Alzheimer's disease. And out of that, temporal is very important because in the temporal region, hippocampus present. Temporal region means almost to the side by side of the ears, 2 ears. And occipital is the back part. So hippocampus exists within the temporal lobe. So this region, identification of this region is also important. So now coming to one system, because we are talking about some system has to be generated or has to be implemented. So I'm talking about the system. So this is one model known as Masonnet model, multi-scale attention residual network model, which can be given to the system for the detection and then for monitoring. I'm coming to the monitoring part later on. So first I'm going to the detection model. So this model, what we'll do, this green, first green, the top left corner green slide, basically, it is showing that it is actually the layer for denoising and for the denoising or filtering purpose. Basically, it will remove the images. So it is doing the denoising, and it is basically improve the image structure. So here the input is the images. Which images? MRI images. But again, I'm telling about that MRI images are not doing the MRI is not so easy because it is expensive, very expensive, and its availability is not also there in all remote areas. Also, we are concerned about the remote areas, and as it is expensive, it is not be bearable by remote village persons sometimes. So I had the input or the MRI images, and then after denoising, this given to the convolution layer. These gray blocks are the convolution layer. There are 2 convolution layers having 64 number of channels. What is done in the convolution layer? We have used 3x3 convolution. So suppose we have the input image like that, and with that we are applying one kernel or filter. So which filter will do the convolution with the original image. So I'm taking one sample from here from the original image, and we have applied this kernel. So if we do the convolution, so we'll get one value of reduced size. So what is that actually significance is that? So uh, to know the more important features or to learn the regarding the more important features of the images. So that's why we will do the convolution in this way. So if you go in the previous, so in the right hand side, which is known as the shortening path means it is encoding layer, and the right hand side, the enlarged path means it is decoding layer. That means here we will do the convolution, in the right hand side we do the deconvolution. Convolution we will do because of better learning regarding the features or better learning of the different parameters of the images. So here it is like that we just do the simple convolution, the multiplication and addition, we will get this value. And if we use stride of 1, so all these fields will be filled out of the output. So this is the process how we do the 3x3 convolution. Stride means shifting of kernel by 1 unit. If we do the shifting of the kernel by 2 units, it is a stride 2. So in this way, we will get the output. That depends on purely on the users, or we can see the bit for the beta learning. After that, we have used the max pooling of 2x2 to just reduce the feature maps into the hub, or we can say reduce the feature map. As we use the 2x2, it will reduce to the half of the feature with respect to the previous output. So max pooling, what it will do if we apply the kernel of 2x2, so with that 2x2 matrix, the maximum value will be extracted at the output. So here you can see the first block is 1156, so 6 will be extracted at the output. In the next block 2478, so 8 will be extracted. In the next block 3212, 3 is the maximum, 3, and the next block 4 is the output, 4 is the maximum, so 4 will be added at the output. So here 64 number of channels, then we increase the number of channels to 128, then 256, to then 512 for the better learning and the deepest learning. Now, here after doing that, when we come to the 1024 number of channels, then we start to deconvolution. When you start to deconvolution, so here in that dark red color is known as the deconvolution. In deconvolution, what we will do? Suppose we have this type of input for 2x2, 0, 1, 2, 3. What we have received here, 6, 8, 3, 4. We can use that also here. So 0, 1, 2, 3. So we will take another kernel of 2x3, 2x2. So after doing the deconvolution of this, we'll get the output. So how we'll do the deconvolution? So each element of the kernel will be multiplied with the input. So when 0 will be multiplied with this input, so all element will be 0. So that's why first one is filled with all 0. Then we use one stride, and then again we multiplied by next element, which is 1, to the input. We get the 0, 1, 2, 3. Then we use another stride in the downward. Then we multiply by 2. So you get 0, 2, 4, 6 in this way. And finally you get 0, 3, 6, 9. And after getting this, if all these 4, if we do the overlapping and summation, so we'll get the output. After doing overlapping and doing the summation, overlapping and summation means when the two samples will overlap, that will be added. So after doing this, we will get this type of output, so that we can get the deconvolution, so that we can get the original image. Original image again, we can reconstruct the original image, and from that original image, we can take the decision for the detection. So this is the process. So here, these are the I have already mentioned the noise and filtering layer, then convolution, Then this dark green block is used as the max pooling layer. Then again convolution, number of channel is increased. Important thing is that skip. Within these blocks, we have used the residual network also. What is the new thing here? Within that convolution, we have used ResNet, residual network, and as well as attention module also, ECNet. So I'm coming to that part later on, these two residual network and the what I said, attention ECNet, that's attention module. Important thing, skipping. Skipping is the main characteristics of the residual connection. So by this, what will happen? No information will be lost from the input to the output because of convolution and deconvolution. So that's why skipping is done. Another thing, skipping is done for the residual network so that gradient vanishing gradient problem will not appear. That means if we start to doing the feedback from the output to the input, so each time comparing with that, some gradient will be generated, and some when it will go to almost zero due to the large value of the denominator, so it will be vanished, so that information will be lost. So to overcome this vanishing gradient problem, skip connections is used basically to keep all this information intact up to the output. So already I have mentioned these things. So that is also mentioned. Encoder is used and attention is used within that blocks. So this is the encoder part. It is used within the convolution block. Their input is taken and then 7x7 convolution is done with 64 channels with 2 strides. I'm not repeating that convolution and stride again. I mentioned. Then it is go through the 3x3 max pooling layer. In the previously we have used 2x2 max pooling layer. Here we have used 3x3, so output will be the 3x3. Stride 2. Then it is given to the 4 convolutional blocks, and first convolution block is having 3 will be repeated 3 times, second 4 times, third 23 times, again the last one 3 times. This all things is done for the deepest learning only, for the features, and to give the attention on the main or important features only. So what here it is done, 1x1 convolution is done with the 64 channels to take the important regions or the important parts of the brain, and then 3x3 convolution used for the max pooling, and then again it is used 1+1 with the high increased number of channels. And that identity X, this is the skip connection. Skip connection is input will be again given to the output, so that the data learning will be done for the next block also. So then it is go through the average pooling and fully connected layer of 4 layers, as because here we have used 4 detections: Alzheimer's disease, mild cognitive impairment, and very mild cognitive impairment, and the heavily person. 4 classes are there, so that's why fully connected 4 layer will be used here. So, and another thing is attention module. Attention module, here we have used the efficient channel attention module within that Mason's model, where input is taken from the previous convolution layer, and input having the dimension of channel, height and width, number of channel, height and width. Number of channel will depend on the number of kernel is used here. Then we use global average pooling, GAP, global average pooling. So global average pooling is used for the better or the important feature selections. What it will do, it will convert each kernel into a single value, so that it will form a one-dimensional vector and of length the channel. If we use the 12 channel or the 64 channel, so it will having a one-dimensional vector of 64 length. So then again one-dimensional 1D convolution is done here The next is the ping blocks. There one convolutional 1D convolution has been done. The reason is that here to find out the relationship between the neighboring channel. From the single channel, the most important feature will be extracted. It is fine. Then it is compared with the neighboring channels. Out of the neighboring channels, which one is the important? Then it goes to the sigmoid function, sigmoid activation function, and then it is included. Why sigmoid activation function is used? To calculate the importance of the channels from 0 to 1. Actually, to calculate the weights of the channel. Then that weights will be multiplied by the input again, so that finally the input, finally the most important features from the input will be extracted. Then it will be given to the next block of the convolution also. In this way, most important region and the most important feature will be located. That's why we have used the ECNet attention module. So what is done? Unit structure is done. Within that unit structure, HDL block is used because to overcome the vanishing gradient problem, and then to detect the most important region of the brain which is responsible for the Alzheimer's disease, we have the attention module can be used. This is the summary. Input, the 2D slice input will be taken, and then it will be trained with some activation function, then max pooling will be done, then output will be taken and output will be compared. Compared means the predicted output will be compared with the actual output, and loss will be calculated using the cross entropy, and then again it will be given to the input for the better learning. So after full learning, so test will be done and the prediction will be done with the same process. The thing is that here we have used the cross entropy loss function to calculate the loss or to calculate the difference between the actual and predicted value. So we have used this cross entropy loss because it is actually cross entropy loss function is actually calculate the difference between the two probability distributions of actual output and the predicted output. So that's why cross entropy loss is used, and this is more suitable for the multiple class detection. So that's why it is used. So here these are the two formula which can be used for the loss calculation. If we use the binary class, so that can be used, where y is the actual output, y cap is the predicted, and when it will be multi-class, this formula can be used, which is given in the right hand side. So now this is one kind where the MRI is used as MRI images as used as the input. Now the thing is that I have mentioned MRI is expensive and it is not also all the time comfortable for the patient. So it is better to go in another less expensive way and which will be comfortable for the patients also, that is speech-based techniques, speech-based computational techniques. What are the things? There are some important features within the speech which can be detected, which can be spored. What are the features? These 6 are the features. First is BNT-SF score. What is that? Boston Naming Test short form. What is Boston Naming Test? Boston Naming Test is there. Suppose one person, one candidate is there, which is who is affected by the disease or going to be affected, and another expert is there. So what will do the expert? Expert will show 10 or 10 to 15 names by written, and then after that he or she will be asked to recall the name. It is better to go with the 10 names. If it is 15, it will be problematic for any person also. So it is better to go with 10 number of names. So after showing, it will not be listened. It has to be shown the names. After showing, the patient or the person will be asked to recall. Based on the recalling, the score will be given. The thing is that how score will be given? If the all 10 names will be said sequentially by that patient or by the person, so it will be high score. That means he or she do not have any that tendency of Alzheimer's disease affected. It is okay, but the names are told by the person, but it is not sequential. All 10 names will be told by that person, but it is not sequential. So it is also good, but it is quite alarming that he or she has to be monitored. But one thing, out of 10 names, suppose 6 names can be told by that person, 4 names cannot be done, and that 6 names also be recalled arbitrarily. So it is very, very alarming, and it may be scored as the affected or disease affected. Another test, MUCA, Montreal Cognitive Assessment. These are all speech-based assessment. It is a 30-point test where patients or the testing person has to be draw some clocks. It is actually clock drawing test. Another test is also there. I'm coming to the first clock drawing test. So first it will be observed the circle is perfectly drawn or not. The values in the clock are written correctly in the correct order or not. Then one time will be asked by suppose 11:10, and he or she has to be shown by 2 hands the 11:10 position. Is it done correctly or not? So based on that, the score will be given out of 30, and if this score is less than 26, so it will be poor performance and it is having the MCI, that is mild cognitive impairment, which will be converted later on, may be converted later in the Alzheimer's disease. But if it is the score is greater than 26, there is no problem, it is okay. And another test can be done in the same method, that is 4-5 names arbitrarily told to him or her, which is not related. Not related means some bank's names, then some books name, then some disease name will be told to him, and then he or she is asked to be recalled. If that recalling is in the same sequence as per the experts, that is good. But if it is not that, and if it is also that if it is only 1 or 2 can be recalled, it will be low score, below 26. That means MCI will be there within that time. Another test, Whistler memory test. This is basically storytelling test. That means one story, short story will be listened to him or her, and then immediately after stopping, he or she will be asked to recall the story, and it will be followed that he or she is giving the proper keywords of the stories and sequentially events. That one story is consisting of many number of events, so the events are recalled sequentially or not, or any events is missing or not. Based on that, test is done. And same thing in the second one, which is Whistler memory logical test memory 2, same thing is done, but there the patient will be asked to recall the story after 20 to 30 minutes. So it is for the testing of the memory, how he or she can be recalled for a long time gap also. Another one, HVLTR Form 3, it is also having 2. It is HVLTR means Hopkins Verbal Learning Test. What will be done? Here 12 listed items will be shown to the patients, and after that, he or she will be asked 3 times to recall. 3 times. Immediately after showing, he or she will be asked for recall, and that scope will be given 3 times. Based on that, the score will be done. And which is the next one, HVLTR delayed recall. That is same will be done, 12 items will be shown and 3 scope will be given, but after showing 20 to 30 minutes gap will be there. After that, he or she will be asked to recall. Based on that, score will be given. So depending on that score of the different people, or the different people healthy, unhealthy, MCI, affected, the data will be generated. That based on that data, using that data and using certain deep learning models, prediction can be done also, which is very less expensive and which can be done in any position and which can be done in remote areas also, from the remote locations. One people expert is not in that same position also, that for that situation can also be that this type of test can be done. So it is much more effective than the MRI images will be used as the input. So another thing, some data will be always available in the publicly available. So these are basically the clinical data. So based on the clinical data, here some education level, socioeconomic status, because obviously Alzheimer's disease is very much depends on socioeconomic status also. So some data has also been shown that for the poor countries, the Alzheimer's disease affected people is very high. So socioeconomic status is very important. Mini-mental score of examination, volume of the brain, Adler scaling factor. So something education level, socioeconomic status, these are not particularly relevant to the patients. That depends on the overall situation of the society. Depending on that, some food habits may also be changed. So that is also responsible. And mini-mental score of examination means depending on that surrounding, that family persons, that friends, that is also responsible. So this type of data are available. Based on that data, some important thing came as the output. So it has been observed that the male candidates having higher number of male candidates having the dementia, or we can say the Alzheimer's disease, but female candidates is less compared to the male candidate, which is having almost 53.50% less. It is very good symbol. And if we go with the next thing, here another data from that publicly available data, it has been observed that male first table is of male candidate and second table is of female candidate. So for male candidate, it has been observed that Alzheimer's disease generally occurred in the minimum age of 56, but wherein for the female candidate, it is at 61. It is a good symbol, and which is matched with these things. The less number of female candidates will be affected by this disease, neurodegenerative disease, or we can say the dementia. But another thing is not good for the female candidates. Here in the upper table, we have seen MCI. MCI means mild cognitive, that is before Alzheimer's disease, before disease, with mild symptoms, which is at 56. But CMCI means converted to MCI, that is, which is known as Alzheimer's disease also. CMCI means converted to mild cognitive. That means which is actually Alzheimer's disease. So if we consider below 1 as the Alzheimer's disease, so from MCI to Alzheimer's disease, converting age is for the male candidate 56 to 61. So it is a long time. So it is a long gap. So the practitioners or the clinicians can get chance to slow down the or progress of the disease. But here, for the female candidate, MCI happens in the same age with the male candidate 56, but the conversion time is very faster, 56 to 59. So the conversion rate, that means once one female candidate is getting affected by the MCI, that is mild symptoms, so there is a high chance to go to the converting to the Alzheimer's disease. But for the male candidate, there is a less chance. So this is the one thing. And if we go with the brain volume, so one new factor is there, which is known as Adler scaling factor. What is that? We have the overall volume of the brain, which is the skull, and another is below that layer, which is cortex. So if the cortex is getting strained, and if we multiply with some factor, with some constant factor with that volume of the cortex, and to come back to the original volume, the overall volume of the brain. So if that value or the factor is high, so that factor high means original volume of the brain, inner volume of the brain is less. That means it is shrink. Shrink means neurons damage or die. That means Alzheimer's disease or the neurodegenerative disease will be occurred shortly. And scaling factor means that overall volume and the cortex volume different. That means the inner volume cortex, if we multiply the inner volume cortex by some factor value to get back the original volume, so when this factor value will be less, it is good. When the factor value will be high, it is bad, which is indicating the neurodegenerative disease. So this is the main thing here. So the picture, the orange one, where what is showing that the scaling factor is high for the people which having the Alzheimer's disease, that is which is indicating by the 1. And the blue one, it is the less value, that is factor is less. That means those who not having the dementia or non-demented people, the healthy people, you can say. So here I have discussed two kinds of input. Using that input, the detection is possible. One is MRI images of the patient. Another thing is that the speech. Instead, with that MRI, speech is very comfortable and attractive because it is less expensive and it is used for remote areas. Instead of that, some drawback is there. Main drawback is that within that continuous monitoring is not possible. But actually, to detect the Alzheimer's disease or neurodegenerative disease from the earlier stage, continuous monitoring is necessary. That's why this kind of wearable device is necessary, or wearable device has to be implemented. What is that? We can use wearable cap, or we can use any headbands. What is that wearable cap or headbands? Having different electrodes to measure the EEG signal, electroencephalogram signals, because Alzheimer's disease is very much related with the EEG signals. How? That when the communication will be stopped by the neuron, or the neuron will be getting damaged, the signal, the brain signal will capture the damages gradually. So this type of signal is very important, where we have used some sensors, which is IMU sensor, which consisting of accelerometer and gyroscope, which can also monitor the movement or the motions of the candidate, which will also monitor or capture the data of heart rate or HRV. And temperature and light sensor is not important. Basically, important is that EEG signals and the movement, that is controlled by the accelerometer and gyroscope. After capturing the data, it will be given to that data will be captured or collected by the module, data acquisition module, It may be done by any microcontroller or Raspberry Pi. And then after that, that captured data or the collected data will be processed. That is pre-processing of that data to remove the noise, to remove the unwanted data, to overcome with the data which is having null data, or to normalize the data. The signal processing will be done here. Then FFT will be given. FFT will be done on that data. Then it will be given to the AI model, or we can say that it will be given to the model. It may be deep learning model, it may be machine learning model. Here we employed that MathNet model, what I have discussed in the earlier. That model there is employed, and after that, depending on that data, that model will detect the risk, that is high, low, moderate, whatever it may be, and that information will be uploaded to the cloud, and with the cloud, the one apps will be there, which will be installed in the Android mobile, where that Android mobile will be connected with the data, and from the mobile, that notifications will come, or the output or the result will show for monitoring. Is the data easy, data is good, or showing some alarm, or the sleep disturbance is there, or any movement problem is there, all things will be shown in the apps. So based on that information, or based on the notification, it will monitor. And that notification will be communicated through email or WhatsApp to the caregivers as well as the practitioners, so that depending on the continuous monitoring, if there is some alarming thing is there with risk level based on EEG data of the movement, so that can be monitored and that can be treated. So in this way, one wearable device can continuously monitor the patients, those may getting affected in near future with the Alzheimer's disease or any kind of neurodegenerative disease. That is very important. So up to that, I'm trying to show you how the intelligent system can be implemented based on the data and based on the deep learning models. Thank you for your concentration. Thank you.
Thank you, sir, for your informative and valuable speech for with us. I forward the session to our chairperson. Please, Pramod, ask you questions on the behalf of the participants.
Please, hello. It's not clear to me. First of all, find out the specific problem which will serve the society, so that AI can be applied in anywhere, but for a good project or good AI healthcare system, so first I have to identify the problem, then try to learn regarding different hardware systems, like sensors, which sensor will be suitable for that, because all sensors are not suitable for all purposes. And another thing, which model will be work better, or it needs to be modify something as per the requirement. This is main thing. Main thing, deal with some hardware components which are related with that problem. Before that, fix or find out the correct problem which will serve the society. Biggest challenge is data, availability of the data. Okay. Can I leave?
Yes, sir. Yes, sir, you can.